And which countries is the OET exam accepted?
Which can be considered as one of the major benefits that the students are getting. There is no negative mark.
Can you please explain the structure of the OET, like including the modules, times, durations, what is it and how is it like?
So preparation time varies from student to student. Some of the students give all their time to the preparation. Some of the students are working.
How is OET exam different from the other English exams?
The doubt clearing sessions, like I mentioned, doubt clearing sessions are also provided if the candidate is having a specific doubt related to any specific module that is arranged. One-on-one sessions, one-on-one assessments.
So hello everyone and welcome back to our podcast on Academically. I am Sunidhi Shahi, your host for today, and today as our guest we have respected Saiqa Khan ma'am, and she has an overall experience of 4 years as an English language educator and 3 years as an OET trainer. She specializes in preparing individuals for the Occupational English Test, that is OET. She holds a master's degree in English language and literature and is currently pursuing her PhD in the same. She has various diplomas in teaching English to the speakers of other languages and teaching English as a foreign language as well. Thank you so much for joining us, ma'am. It's our pleasure to have you here.
Thank you so much for having me here. It's always been a pleasure.
Yeah. So, ma'am, I'll just start with the very basic question, like what is an OET exam and who can opt for it?
Okay. OET, firstly, it is Occupational English Test, which is specifically made for the healthcare professionals. And even in this OET, you have lots of professions who can go for this test. For example, it covers the professions like dentistry, dietetics, it can cover medicine, nursing, physiotherapy, pharmacy, almost 12 professions it covers. And definitely, if you belong from any of these 12 healthcare professions, you can go for it. It covers, let me list these 12 professions: dentistry, dietetics, medicine, nursing, pharmacy, physiotherapy, podiatry, radiography, speech therapy, veterinary science, and that's it. Yeah, I think I covered all. Nursing as well.
Okay, ma'am, thank you for answering. So, ma'am, my next question would be, what are the benefits of the OET exam and how is it useful for the students?
Well, yes, there are multiple benefits for it because if we talk about OET, which is specifically meant for healthcare professionals, this way, the candidate who wants to go for the OET exam is bound within his own healthcare environment. He has no worries to generalize the understanding of English proficiency. He can, improve his communication. He can improve his English language proficiency within his own boundaries because he has this day-to-day communication with the patients. So in this OET, he will be imitating his real life scenarios. He will be having the relevant content that he's going to prepare himself for. He will have definitely the improved communication. For example, if you are preparing yourself for an OET, and the major benefit would be you are learning English language with respect to your profession. What better than that? Because if you are learning English with respect to your profession, you will be dealing with the patients you deal every day with. You will be reading the content that you have to read there in your profession every day. You will be listening to the scenarios that you get to listen in your context every day. So this is how it is very useful and comprehensible for the candidates who opt for it.
Okay, ma'am. Yeah, I think it's pretty much clear. So, ma'am, moving forward, my question is that how much does a student has to pay for the full exam?
Okay, for the full exam, right now, if I talk about the Australian dollars, it would be 587. But there are some countries, where the fee varies from place to place, location to location. So the starting, if somebody, for example, you're opting for an exam to New Zealand, you couldn't clear the speaking module, let's see, and then you can separately go for the exam. So 200 to 300 Australian dollars to 587 Australian dollars would be there.
Okay, ma'am. And which countries is the OET exam accepted?
There are many countries, approximately, I believe, 13 to 14 countries. Australia is the major country, Canada, USA, UK, UAE, Qatar would be there, Maldives would be there, New Zealand, Philippines is there, Spain, Ukraine, yes, all of these countries.
Yeah. And ma'am, for this particular exam, so is there any negative marking or what is the marking pattern like?
Well, that's a major, good thing, which can be considered as one of the major benefits that the students are getting. There is no negative marking. One good thing, and the scores that you would need to qualify the exam varies from country to country. For example, in UK, you can get B grade in reading, listening, speaking. You can qualify writing with C plus. In one of the countries, for example, if I talk about the Ireland, there if you get C plus in some modules, you can. So countries' requirements are there. As per that, you can check how which grade you have received. As per that, you are good to go.
Okay. And ma'am, what is the procedure for this whole application of OET?
Okay, that's a good question. So I would start by saying, first of all, you'll have to simply go to the official website of OET, which is oet.com. There you will be creating an account. If you do not have one, you can easily, like we always do, making Gmail accounts and all, you can create an account there. After that, once you log in into that account, you will see the online application form. You will have to fill that form. They would require your personal details, they would require some other contact information, etc., etc. Then after that, you have submitted all this, you will be able to choose the type of the test. See, within OET you have one more option, that is, you are a nurse, you will choose the nursing option. You are a doctor, you will choose. So after that, you will be choosing the OET exam as per your profession. Then you yourself will be able to choose the date as well
Mhm.
as the venue where you would want to go for the exam. Then after that, necessary documents and all would be there that you would need to upload. After you do all this, then you'll have to pay the fee and you will receive the confirmation email. After receiving the confirmation email, you will have to save these credentials, because once your exam is done on the same account, you will have to log in again. After 15 to 16 business days, you'll be receiving the result through same credentials.
Okay, ma'am. Yeah, that was, I'm sure, a very informative thing for a lot of students because students get confused on the procedure
Right.
because, there are a lot of information going on, a lot of resources they are getting, and every
Right.
resource has different information. So I'm sure this will be very helpful for them. So, yeah, ma'am, moving forward, can you please explain the structure of the OET, like including the modules, times, durations? What is it and how is it like?
Okay, well, this is what I was waiting for, because OET is the best part of my journey.
Yeah.
So, OET, first I'll be talking about the structure of the exam and I'll talk about the time duration with the same. So, the structure, once you go for the exam, the first module that you'll be going for would be the listening test. For listening test, you'll be given 45 minutes, and in the listening test, you will be assessed on the basis of how efficiently you can listen to the spoken English in any healthcare context, how efficiently you can listen to that. So, you will be listening to the conversation between colleagues, to the conversation between a specialist and a patient, to the sometimes a presentation given by any healthcare professional, sometimes an interview taken. So, everything would be related to the medical context only. Then the second paper would be of reading, where you will be having 60 minutes. Again, the content will be very much related to your healthcare context. Whatever you would be reading would be the articles in reading, sometimes the internal workplace communication. You must have noticed when you go to any hospital, there are those notice boards where guidelines, safety procedures, emails, etc., all that would be there. You will also get the content like research articles. Everything would be related to the healthcare context only. Then the third paper would be of writing. In writing, you will again have 45 minutes, and depending on the profession that you have, if you are a doctor, you will be writing the letter as a doctor. If you are a nurse, as a nurse. So it has its variations. And typically, you get some types of the letters, like you sometimes write a discharge letter, sometimes a referral letter, sometimes a transfer. And the fourth exam would be of speaking. Speaking is the last test for the day, and in speaking, you will be again performing the role of a profession that you're having. If you're a doctor, you will be performing as a doctor, and the other person, that's called an interlocutor, who is going to perform the role of a patient, sometimes the guardian, caregiver, patient's son, patient's daughter, patient's father. So it is kind of an imitation of the real life scenario. So you will be told during your preparation courses, etc. You will be told how to follow the instructions, how to do it. So for speaking, it would approximately take you 20 minutes. Yeah, because you'll have to perform the two role plays. And you will have to have a discussion with the interlocutor based on the card that you'll be getting. So 20 minutes for speaking.
So, ma'am, my next question would be like, how much time does it actually take for a student to prepare for the OET, like also along with their studies?
Well, first of all, every student has unique needs. So preparation time varies from student to student. Some of the students give all their time to the preparation. Some of the students are working. They have 8, 10 hour shift, and then they are preparing for OET. So the requirements are different. So if being a OET trainer, I always suggest the students to give at least 1 month, at least. And if you feel that you can cover all the requirements in this 1 month, and this 1 month will require your consistency. So consistency is key for your preparation. 2 months, some students are already working, so they require 2 months. So it varies from a candidate to candidate. But yes, using the authentic material is very, very important. Showing consistency in your preparation is crucial, because without that, without having a proper study plan, you cannot just practice for 1 week and then leave it for one more week, and then for third week you are resuming the practice. So consistency is there. So preparation course will vary from the candidate's dedication, candidate's time availability. At least you should be starting with 4 to 6 weeks.
Okay. And ma'am, how is OET exam different from the other English exams?
Well, that is what makes OET special, basically. So we have other tests, like we have IELTS, we have TOEFL, etc., PT also for that matter. But OET is very different and very beneficial for the healthcare professionals. How? Because if you are going for any other English test, the proficiency that you'll be tested upon would be very general. You'll be asked to write, let's see, you're going for a writing exam, and you'll be told to write an essay on something. You are very, occupied with your job. You don't have the time to read everything that's on the earth. So you are very much restricted to the vocabulary you are exposed to. So when you get an exam that is based on your context, that is based what you do on your daily basis, that makes it easier for you. So the passing rate for OET as compared to other English tests is also better than that. Why? Because like I mentioned in the other test, everything that would be asked you is very general. You might be asked to write something on global warming, tourism. That's not none of the concern of the healthcare professional. Now, if you're asked to write a referral letter to the patient's father, you know what things you would be adding there. You will also get some notes. The preparation time is also going to be there, which makes it easier, convenient, because everything, it is very profession specific content that you will be exposed to. You will have realistic scenarios. Whatever, if you are practicing listening, you will listen to the audios that happen with you on daily basis. You will read the content that you usually do in your healthcare settings. You will speak to a patient that you usually do in your daily life. So everything is there. It is very profession specific. And also, the most important point is career opportunity, employabilities that you get through this OET. Many, if I am in UK, if I want to work in UK, anyone who would be hiring me in UK need a proof that I have a public dealing. I am able to speak with the people that I'll be communicating with. So this is what gives them proof. Yes, in your context, he's a healthcare professional. In his context, in his field, he is at best. So this is what makes it more special and easy as well for the healthcare professionals.
Yeah, I think that is really great, ma'am. So, yeah, ma'am, would you like to share your journey as an OET trainer? Like, how did you start your journey, or, how has your journey benefited the students or benefited you in any way? So, yeah.
Yes, this is, I would say, very important question to me and very close as well. Uh, as far as I consider my academics, I have completed my master's in English language. I have, in fact, when I completed my BEd, it is called special education BEd, where I get to deal with some children who are not mentally, fit. They are intellectually disabled. So, in a way, I have always been in touch with the healthcare professionals. I belong from the family of healthcare professionals. So I deal with them on everyday basis. So when I was doing my academics and I got introduced to this OET, I would say this as soon as I learned about OET, what I would say is that I was very focused on this, and I made my mind that I am going to pursue this. Then, when I started as an English language instructor for a year or so, I got introduced to OET. Then I pursued this as my career option, because being in touch with the healthcare professionals on everyday basis, belonging from the academics of English language, I wanted to, stay in touch with both of them. So this was the best way to be in touch with them. And for the 4 years, I have been in touch with hundreds and thousands of students. And my journey with OET has been very emotional, has been very, special
Yeah.
for me, because as a trainer, my passion is teaching. And when I see a
Mhm.
student, when I empower a student and I see my student getting the grades they are aspiring, they wish they get, I think that brings me the utmost satisfaction. And that's when I realize, okay, this is basically what I want to do. And students often
Yeah.
consider my teaching strategy as very, uh, happy and joyful.
Yeah.
That's it.
So, ma'am, like, what is the most special or like unique part of your lectures that has proven effective for students?
Okay. Well, yeah, there are, the I believe that teacher is the backbone of any, empowering the student. Teacher is the one who plays the not the major role, but the basic role. So I
100%. Yeah.
believe that when I give my lectures to the candidates, there are certain things, objectives that I have in my mind. The first one would be the personalization of the sessions, because, like we discussed previously, every student has different requirements. So, when I prepare or when I plan my lesson, I consider the requirements as well as the expectations of my students. So, keeping the sessions personalized, making it very, make it very effective for the individual. After that, I make sure I use technology, because I started OET journey in 2020. Everything was shut at that time. So technology also plays a major part in my this learning, because I believe in multimodal learning. If I teach my student, we listen to various audios, we watch various videos. This makes them engaged, and also my sessions would have constant assessments. I believe in constant evaluations, so that my student will get to know the strong areas as well as weak areas. Then we work more on the weak areas. And every time, be it weekly, be it after 10 days, I take doubt clearing sessions, because students come
Yeah.
up with very different doubts. Every time they have different queries. So, and doubt clearing sessions also go one on one. It makes the learning very effective. And Alhamdulillah, I am getting good grades. My students are getting good grades, and that's the most important thing about it.
Yeah, that's great, ma'am. So, ma'am, when we talk about students, I would also like to ask you that what are those reasons that you think that, students, what are the mistakes that students make while preparing for the exam, or how one can avoid it?
Well, yeah. Sometimes when we start a journey, we should always assess where we stand. So once a student makes up a mind that I have to go for the OET, the first thing that the student should do is assess his current abilities. That is what students don't do. They start, okay, I'll go for 1 month course, I'll go for 2 months. No, check your present situation, accordingly do that. The first mistake. And the second thing that they do is they are sometimes, limited to the vocabulary. They do not focus on the vocabulary development and all. They feel that, okay, whatever vocabulary I have right now is enough for me to pass the exam. This is also something that they should be avoiding. And the most important part is not regularly reviewing the mistakes. If you are doing any mistake, if you find that you have any weak area, you still do not, maybe your listening module will require only 3 papers, but your reading requires more attention. So this is where they have to realize which module needs more efforts, where what are the weak areas, and time management. Yes, this is a major mistake that the students do. For example, you would be given uh, 45 minutes for your writing test, and when students practice, they are like, okay, let me do it in 1 hour. Then they get used to the extra time, and on the day of exam, when they are actually attempting the test, they have a habit of doing what? They have a habit of attempting writing paper in 60 minutes, and then they laugh. So this is the major. Make sure that the time that you're consuming during the practice is the exact time that you'll be getting on the day of exam. So this is the major mistake that the students do.
Okay, ma'am. So, ma'am, now I am also coming to my second last question, which is any tips or tricks for students who are preparing for the OET exam?
Well, firstly, the opposite of what I mentioned as an answer to the previous question, totally opposite of that. And the second thing, the major tips and tricks that definitely would understand the student would be the same. First, understand your current level of English proficiency. Once you have understood that, then vocabulary development. See, if you are giving me your 2 months for the OET preparation, you have to. So for these 2 months, if you just add one word every day, see how beneficial it can be. By the end of 2 months, you would have learned 60 new words. You would have added. So adding vocabulary would be one of the major tips. Next, time management that we lack, and that is the major mistake. So time management is important. So major tip would be, whenever you are practicing any paper, make sure that the time that you are keeping, you are going for the let's say you are practicing your reading, make sure you are doing it within the time boundaries that you have on the day of exam also. And also realistic practices. If you are speaking, like speaking is the imitation of the real life scenario. So when you are doing that, try to practice it with your colleagues also. Try to include imitate that in your real life scenarios. And the major tip definitely would be constant evaluations. Whatever you are doing, keep on going for the mock test. And at last but not the least, stay informed. Because, for example, last year, what was acceptable in OET, this year it's not acceptable. So there are constant updates on OET. Stay informed. Keep on checking the official OET, what can be done in OET. Lastly, the scoring was different. This year, the scoring has
Yeah.
been updated. Lastly, the
Mhm.
words, phrases were used in OET. This year, we cannot use those words. So staying informed is the major important tip.
Okay. Yeah. So, ma'am, coming to my last question. So, would you like to say anything to the aspiring candidates on how they can choose academically for their OET preparation?
Yes, for sure. We just discussed about do's and don'ts, and I'm sure the academically gets you all the do's that you should be doing in your OET. So, the first and the foremost thing in the academically would be the preparation that they provide. So, the assessment of the learning styles that your tutors give you here, the content that is provided by academically is authentic, it's official content. Because you will see that there are many OET preparation providers, and the content that they provide to the candidates is not authentic. So academically takes care of that, and which is the most important part for a candidate who is preparing himself or herself for OET. So the resources that you'd be getting would be very authentic. And the most important factor here is the flexibility. So, because as we all know, the healthcare professionals do not have time to attend the class whenever we tell them. They have the time to attend the class as per their convenience. So this availability from academically is also very important for the healthcare professionals, because the time that they choose, we'll be taking the class on that. The time that is convenient for them, the time that fits them, is what we provide them. So this is also very important. And tracking of the progress. We get the updates of the, if the candidate is attending the class regularly, you will get the update. If the candidate is missing the classes, we will get the updates. If the candidate is submitting the assessments, that is, everything is on a track. And the doubt clearing sessions, like I mentioned, doubt clearing sessions are also provided if the candidate is having a specific doubt related to any specific module that is arranged. One-on-one sessions, one-on-one assessments, that is the most attractive part of the preparation, and which is provided by academically. So definitely academically would be the better option to choose.
Yeah, thank you so much, ma'am. So, yeah, everyone, I would like to also mention that you can connect with Academically on our social media platforms and also on our website with academically.com. We are available everywhere. You just have to fill the form or message us in the chat box, and then we will be happy to help you all. So, yeah, thank you so much, ma'am, for all your information and for all your answers. I'm sure that, all the aspiring candidates who are going to give their OET exam will get a lot of help from this session. So thank you so much for that.
Thank you so much. Thank you for having me.
Yeah, thank you so much, ma'am. And thank you everyone for watching us. We will be coming up with more such podcasts on different exams, different courses. So stay tuned, and yeah, do not forget to hit the like, share, and subscribe button, and follow Academically for such videos and sessions, because our faculties, our more guests will be coming up, and our founder and CEO, Dr. Akram, will also be joining us in upcoming sessions. So yeah, thank you, ma'am. Thank you so much.
Thank you.